Good afternoon, everyone. Welcome back to the Knaufel Center, and welcome to everyone who is watching us online. My name is Immaculata DeVivo, also known as Mac. I am a faculty co-director for science programming here at Harvard Radcliffe Institute, and it'll be my pleasure to take you through the rest of the afternoon. And so, just to acknowledge this morning's terrific sessions on mental health equals public health, and in the second session, the mental health toll on our vulnerable populations, in particular trans youths that we talked about. So what to expect this afternoon? The terrific program continues, and we will welcome our keynote speaker, and then followed by session 3, which is exploring social justice, gender, and mental health, and conclude with session 4, which is working towards resilience and prevention. It is now my pleasure to introduce our keynote speaker, Devin-Norelle. Devin is an extraordinary professional model and trans advocate and opinion writer. And I found out that Z is the host of a new show on PBS that airs Tuesday, May 2nd, called Brave Spaces. So I encourage everyone to tune in. Devin-Norelle will be in discussion with Dr. V. Varan Chaudhry. Dr. Chaudhry, also known affectionately as V, is an assistant professor of women's gender and sexuality studies at Brandeis University. I'm refraining from making any formal remarks from this morning because I will share my reflections of the 2 days at the end of the program. And with that, I welcome V and Devin-Norelle.
Hello, everyone. It's really exciting to be here and to be in conversation with Devin-Norelle. I have a few questions. We'll sort of guide our conversation, and then we're really excited to welcome questions from the audience, both here and online as well. So I guess we will start. Do you want to do this?
Oh, sure.
So we wanted to start with a land acknowledgement and recognize that both the Boston area and Cambridge specifically are part of the ancestral and traditional homeland of the Massachusetts tribe and people. And we want to acknowledge the legacies of displacement, migration, and settlement that have enabled us to gather here today. And we know that just by acknowledging that, we're taking just a small first step forward towards the long and overdue process of healing and repair. And we will continue to confront and address issues of exclusion, erasure, and systemic discrimination in our community through ongoing education and responsible representation. And I know we've already had a number of conversations about Native representation and the realities of Native communities across the United States today, but I want to start with that land acknowledgement. So we've got the last panel was a really great sort of primer for us, especially Tay's talk. So I want to say thank you to Tay for getting us started by really addressing the urgency of this particular political moment for LGBTQ plus folks. Tay sort of characterized this moment as an impossible rhetorical landscape. Mm-hmm. So I want to start by first asking you, Devin-Norelle, what is the impact of this rhetoric on our communities and our mental health collectively?
I think to address that, we first have to talk about what's actually happening in the U.S. right now, and I actually have a similar... We already saw this, right? So yes, there are, according to the ACLU, there are 469 anti-LGBTQ bills across the U.S. Now, that is almost double of what we saw just 2 years ago. In 2016, that number isn't here. I think there were only maybe about 10 bills, perhaps a little bit more, all focused on the bathroom. The idea that trans people would enter the bathroom and would attack you, which was completely erroneous because what would happen is trans people would enter the bathroom and we would get attacked for existing as gender nonconforming people in the bathroom. Now, a lot of these things were shot down back in 2016. Even proponents of trans people acknowledge that based on evidence, trans people were being attacked. However, things have drastically changed. Why? I like to say it's because of the reign of Donald J. Trump. And people have felt emboldened to say that trans people in their existence are threatening or harmful, especially towards children. So, what is that rhetoric, what has that brought? So some of the things that we have heard are that, one, that bathroom bills, trans people will attack you in the bathroom. There's this idea now that drag queens are pedophiles or they're grooming your children. There's the idea that trans people are inherently evil, are inherently trying to reverse or change the landscape of the US in ways that are not moral. And all of this is false. I know that for me personally, I'm sick and tired of waking up every day and being attacked and targeted. It's exhausting. I cannot look at my phone anymore. I cannot look at the news anymore. I cannot enjoy everyday basic things. As a matter of fact, I find myself escaping to a new country every 2 to 3 months because I'm tired of being here. So if I'm experiencing that, I couldn't imagine what you are experiencing every day, whether it be teaching. I can't imagine what kids are thinking in their heads about themselves in states where they're being effectively banned or illegalized for merely existing. I know for a fact that suicide rates are going up, startlingly so. I know for a fact that people feel emboldened to harm folks, to put their hands on folks, to discriminate publicly. It is not easy right now to exist as a trans person or really just as a queer person or a minority at all.
Absolutely.
So that's having a really deep impact.
Thank you for answering that question on so many different scales, from sort of your own individual exhaustion, which I know I can relate to, all the way to sort of what it looks like to see these graphs and to think about these rates and statistics that we hear about, and you kind of almost become numb to them, right? Okay, yeah, we get it. We're under attack. You know, people don't like us. They don't want us to exist, right? And how do we sort of live in relationship to that?
And all for political clout.
Right.
That's what's so scary. Right. Political clout. You're attacking marginalized people because you want clout. Mm-hmm. Look at DeSantis. I mean, I think he's already kind of yeah. Disney has got him in check, I think, at this point.
Let's hope so.
So maybe I can't say look at DeSantis. However, another thing that I'm worried about is the fact that so many people are not speaking up against the things that are happening because, oh, well, it's not happening to me, but it will eventually happen to you. These things all trickle down, or up, if I may. And it's frightening to watch folks stand by and do nothing at all. And again, it contributes to this exhaustion because I'm fighting, I'm saying and repeating the same thing over and over again, only to turn around and to look at people that I consider my allies do absolutely nothing, engage and refuse to engage in what is happening across the country. And you can do minor things like vote these people out of office. Right. Call your senators. And a lot of people do not understand or do not believe that calling your senators will make a difference, but it does have a huge impact.
Wow. Absolutely. And I think, you know, with the pandemic and so much sort of misinformation circulating, there's a lot of apathy around sort of what a vote really signifies, what it means, what's possible with it. And then I think another important aspect of this political moment too is it's a backlash to the amount of visibility that trans and gender nonconforming folks in particular have had. We've had so much more visibility of public trans figures, characters on TV shows who identify as trans and non-binary. There's all of that visibility has meant that there's more room for sort of anti-trans rhetoric, anti-trans legislation to say this is wrong. We don't want people to feel like they have a choice over the pronouns that people use to refer to them. We don't think that people should have a choice over the bathroom they get to use, right? It should be sort of automatic because it was for us or it was for, right? And we're coming back to conversations that have been happening for decades about freedoms, basic freedoms about what it means to self-determine who you are and to choose access to various sort of both public accommodations and things as sort of freeing and generally fun for folks like sports.
I'd have to say I often get confused about why people do not like gender-neutral bathrooms when the gender-neutral bathroom exists in your house or exists on the plane, exists on the train. It really doesn't make any sense to me.
Absolutely.
And again, if you're going to be attacked, no one's going to dress up to attack you in a restroom. They're just going to walk in.
Right.
Okay, let's use some common sense here.
Right, absolutely. And while we're thinking about that, let's move to my next question, which is about, what is the misinformation that we are hearing, and how do we sort of resist and combat that in this moment?
So some of these misconceptions are, for instance, trans people are confused and are tricking others. I actually found if I can find that note, a stat that said about 38% of trans people knew that they were trans before the age of 5. You can include me in that stat. I absolutely knew that I was not a girl when I was younger. My mom, unfortunately, I have a very emotionally and physically abusive parent that raised me as a single mother. She did her best. However, she noticed that I was also not a girl and did try to physically coerce that out of me, the boy out of me. Trans kids are not confused. Trans adults are not confused. We know who we are. And I like to say that my transition is for other people because I've always really been in tune with this person inside of me. I'm a non-binary person. And I'm transitioning, or rather the people around me are transitioning and adjusting to my name, perhaps my new pronouns, which are Z, Zim, Ziz, not new to me, at least for the past 13 years now at this point. They're changing to how people receive and perceive me in public. Mm-hmm. But I like to say I always knew who I was. And I knew that as a child. And I said that to my mom. But parents don't believe that children have their own autonomy, whether it's bodily autonomy or not, don't have an idea of what gender is. We are really paying a lot of attention to everything, and especially to ourselves. So when I say that back then, when I say I'm a boy, I meant that. I am a boy. And I wish that my mom had actually listened. And the thing is, there are so many children that feel so isolated from their families from the simple fact that our parents are still not listening. And a lot of the rhetoric that politicians are using today are being used by these parents against their own children to kick them out. So many kids are homeless. So many kids don't have access to food. So many kids don't have access to education, to employment, because they've been kicked out and now they're just trying to survive. Mm-hmm. Again, I have been lucky in so many ways that even though my mom was emotionally abusive, she put me through school. Mm-hmm. I didn't really talk to her after the fact. That's a story for a different day. Another misconception is that trans people use the bathroom or the locker room that matches their gender identity and that is dangerous. Again, we're the people that are being attacked in these situations, not vice versa. I don't walk into the bathroom to look at you. I walk into the bathroom to take a shower and leave. And honestly, when I go to my gym, I don't even use the shower anymore because I don't want to be stared at for my scars. I live about 10 blocks away from my gym. So what I'll do is go to the gym and stay home and shower. Right. Because I'd rather avoid these stares. I'd rather avoid the comments. However, I have many friends that do change in the locker room, some who are pre-op, who haven't had top surgery, and some who are post-op. And all have been subjected to various transphobic comments, and I'd rather not deal with that. Another misconception is that children aren't old enough to know their gender. Going back to what I said earlier, yes, we are. Back to that stat that I said, 38% of children know who they are before the age of 5. 60% of children know who they are before the age of 10. That's a almost double jump in percentage. Trans people are mentally ill. I am standing before you and I promise you I'm not mentally ill. Yes, I am autistic. Yes, I have ADHD. That does not make me mentally ill. That does not make you mentally ill. And I would hope that you see me as a human and not as someone as an issue.
Right, and I mean, there's so much to the connection between gender and mental illness that structures this whole conference is so, it's rich and it's complicated, and I really appreciated and loved Esme's conversation about the ways that, if you have cancer, you're not described by cancer as being your primary identity, right? But someone with schizophrenia might be labeled as schizophrenic in a way that's supposed to characterize all of who they are. And so, there's definitely a number of sort of overlaps between being trans and experiencing various forms of mental illness, but it's a really complicated relationship, as it would be with any illness, right? We have to really think about what people's lives are like, what people are experiencing, and the discrimination that folks are coming up against, the language that they might be experiencing in the home. I mean, I think about the question of children and gender identity, and so much of that rhetoric and this misinformation is, well, you know, my 3-year-old is saying that they're a different gender than what they were assigned at birth, but they also said they were a bird, right? Or something like that, and trying to use that to undermine children's knowledge of their own bodies. And as someone who has a number of young people in my life, around 3, 4, right? When a child tells you that they're a bird or something that might be sort of nonsensical, you actually have to listen to them to get them to listen to you, right? Like if you need them to put their shoes on to go to school and they're saying, well, I'm a bird and birds don't wear shoes or something, you know, ridiculous like that, you actually have to engage them. And gender is actually a category that has meaning and resonance across their lifespan. So if they're naming that they see what gender looks like, right? And they're recognizing, you know, if I only have 2 options, which you don't to start, but if I only have 2 options and I'm going to choose one, and or you know, I see this person in a different gender than what I'm being called, and that's the one that I want, and they're saying that, and they're saying that, and they're saying that, you listen to your kids, right? And not being listened to over and over and over again can cause depression, anxiety, various other forms of mental illness too. So I think it's a really like precious and complex and very individual, but also really structural relationship.
I think often we forget that children are whole people, whole beings.
Absolutely.
With thoughts and feelings. And we need to give children more credit about what those feelings are and how they're feeling it and how they are expressing it, and allowing them a stage to express it in a safe way where they're not being attacked. And I didn't grow up in a household like that. Right. And I noticed, I'm starting to notice that trans kids aren't allowed that stage to just be themselves, to just speak openly about their feelings. And I really worry about those kids because, as you said, they're now experiencing depression, again, going back to what's happening in various states. They're being openly discriminated against, as not just at home, but in school. And imagine coming home from school to say, wow, this is happening to me, right. And it happens again. You have no safe space, no safe place. You probably do not have any friends who also identify as trans and non-binary who you can confide in. So you're just completely isolated. I couldn't imagine what that would do to a child's mental health.
Absolutely.
And I would only hope that they could survive long enough to make it to adulthood.
Absolutely.
But I do have stats on that as well. Yeah. So, because of everything that is happening these days, we have 73% of LGBTQI youth that report they have experienced discrimination based on their sexual orientation or gender identity at least once in their lifetime, most likely at school or home. To jump to the last stat, 71% of transgender and non-binary youth reported that they have experienced discrimination based on their gender identity. 36% of LGBT youth reported that they have been physically threatened or harmed due to either to their sexual orientation or gender identity. And 37% of transgender and non-binary youth reported that they have been physically threatened or harmed due to their gender identity. Now, these were all taken from the 2022 National Survey on LGBTQ Youth Mental Health by Trevor Project. There are a lot more stats there. If you go to their website, they have an entire page dedicated to LGBTQ youth. They also noted that 45% of LGBTQ youth seriously considered attempting suicide. Could you imagine that as a child?
Right.
Wanting to take your own life because you're queer. And that is a really high number. That's nearly 1 in 5 transgender and non-binary youth people who have attempted suicide. And LGBTQ youth of color reported higher rates, of course, than their white peers. LGBTQ youth who felt high social support from their family, on the other hand, reported attempting suicide at less than half the rate of those who felt low or moderate social support. So we have evidence that supporting your children, that acknowledging who they are, acknowledging their feelings, their identity, actually keeps them alive. Mm-hmm. And yet, here we are still arguing with parents. A parent went in front of the Senate floor today and said, I would rather my child kill themselves then be trans. How are you a parent?
Right.
Why are you a parent?
Absolutely.
LGBTQ youth who found their school to be LGBTQ affirming reported lower rates of attempting suicide. LGBT youth who live in a community that is accepting of LGBTQ people reported significantly lower rates of attempting suicide than those who did not. Now, I can say that for a fact, as a child, I was suicidal, not just because of the things that were happening at home, but I also went to a Catholic school all my life. Wonderful. That meant I couldn't be gay at school, although I was openly out, very frequently policed, very frequently asked why I didn't wear skirts, very frequently told that I couldn't bring a date to whatever event, specifically prom. And almost all of now that I think about it, the school policies, especially in high school, were very anti-queer.
Yeah.
I think because my class in particular had the highest rate of open queer people, they did eventually say we could bring a friend to prom. It's always a friend. For those of you who don't know the connotation behind that, if, say, you read a story about a famous person from the 1930s and they never married, but they had this roommate or this friend, that was not their roommate. Okay? It was definitely their lover. And it happened pretty frequently. I talk about this in my first episode of PBS, specifically J. Edgar Hoover of FBI. But we're going to save that for the episode. Yeah, so I can tell you right now that I did make some wonderful friends. Some of my best friends from high school are still my best friends, about 3 of them. However, I have avoided going back to that school like the plague because it was never a safe space for me. And I also believe that just because you are a religious school does not mean that you cannot make your space affirming for everyone that is existing there.
Absolutely.
And Catholicism, although I do not believe in Catholicism anymore, Catholicism is about acceptance, about about being universally accepting of everyone. And so I just always felt that was very hypocritical for my own high school to essentially make my life a living hell. Just because I openly said, hey, I'm gay.
Right.
I did not do anything else. But morally, I was seen as morally oppressive towards everyone else for just being there.
Right. Right. Yeah, by being out, your personality, your personhood is too loud for the context that you're in. And you feel that on a regular basis when you're in high school, middle school, even elementary school. You know when you're being told to stop talking about yourself or to not to feel so free and, sure of who you are in your body. And that's an important part of really childhood development in general, but it gets really stifled and really, really affected in those contexts when you're being told, like how you can be and how you can't be. And I'm also a survivor of I went to Episcopal school for 12 years. So
I love you saying survival, survivor.
So I can, the religious context and the sort of, it was a really homogenous environment where I was. So I can relate to a lot of those feelings. And I really appreciate you sharing that with us today. And I guess I'm curious if my next question for you is about, really what it's meant for you to think about, being trans broadly, but also this question of what it means to transition. I think another sort of misconception about transness is that you are going from sort of one node of gender to another. And as someone who identifies as non-binary, I don't know if that resonates with you or if that feels untrue. And sort of how do you define transition and what does that mean for you?
I'm just going to jump back to what I mentioned earlier, which is my transition is not for me. It's really a transition that everyone else is going through. Obviously, you all haven't gone through a transition with me, so you haven't seen or you don't know who I was before. However, I'm not the person that's getting adjusted to new pronouns, a new name. My name, Devin-Norelle. Norelle is actually my assigned name at birth. I love my name. I just like the name Devin as well, so I combined the two. I think, though, transition just looks so entirely different for everyone. I at the beginning of my medical transition, had this idea that as a non-binary person, I needed to look and wanted to look androgynous, whatever that may be. In the context that I'm describing now, this is from 2015. It always usually meant a white body. Sorry, I'm gonna have to add some terms here. So there's this term AFAB, which means assigned female at birth, and there's a term AMAB, which means assigned male at birth. So when I thought about androgynous people, or when I looked up androgynous people on Google, I would always see a white-bodied AFAB person with short hair, like a masculine presenting assigned female at birth individual. And so I thought that I needed to be that. I also knew that I really, really, really wanted facial hair. So I didn't know how I would navigate having facial hair and being read as like androgynous, okay? How is this going to work? Luckily for trans people now, we are able to define what androgyny looks like, what non-binary looks like, and obviously I think you also identify as non-binary.
I do, yeah.
And we don't look anything alike,
Right.
you know? We're very different people. Our expressions, our gender expression, and how we view ourselves is distinctly different, and that's what it means to be non-binary. But really, that's also what it means to be trans, because we aren't a monolith. How we get to our place, how we get to where we are comfortable in our gender, that journey will always look so very different for each individual. I came to accept the fact that I just really like to work out, and I wanted muscles, and that for me was androgyny. So I have a beard and I work out. I don't care. I still identify as androgynous and non-binary. And I think that we need, at least in media, more examples of this. Okay, this person is muscular, they're non-binary. This person looks like the definition of androgynous, they're also non-binary. And those two things are okay.
Right. And sometimes folks might pass as a binary gender in the world, whatever that means, and identify as non-binary too.
Right.
I think there's I'm really glad you touched on the fact that, trans experience, and again, another big misconception is trans experience really depends on the person. People make different choices about their bodies. Their medical decisions can look really different. The pronouns they might use, the name they might go by, and a lot of assumptions get made around, well, you must have chosen a different name than the one you were assigned at birth, or you must have you must go on hormones to be properly trans, right? And that kind of policing comes from a lot of different places. But I think it's true that transition can be gender transition, any kind of transition, those kinds of things are ongoing. They're regular, and I know for the regular aspects of kind of human existence. When you move, it's a transition. When you start a new job, it's a transition. And I know a lot of mental health professionals work with this idea of transition to say, that's a time when stressors can happen in your life. And then we put a lot of pressure on this idea of trans because of this sort of, political rhetoric to say, oh, well, who are you and how can you identify yourself in a way that, are you sure? Is this who you want to be, right? Yeah. Is this irreversible? You're making these sort of choices about your body and your life as opposed to saying, this is what you want to do with your body and you trust yourself to do it. I'm in full support of that because I know and love you as a human, and I want you to be full and free and happy and whole in who you are and how you want to move through the world.
Right. And I think what people don't realize is that if you do choose to transition in whatever way, it actually improves your mental health
Absolutely.
a significant amount. For instance, research has shown that the odds of severe psychological distress were reduced by 222% in early adolescence, 153% in late adolescence, and 81% for those who began hormones as an adult. That's a huge number, 222%. I can say for a fact, I can sit here and say that who I am today and where I am in my life and how I feel about myself and my body or just my personhood, I'm 1,000%, despite all the things that are happening in the US, I'm 1,000% happier than I was 10 years ago before I did any type of social or medical transitioning. And to have people acknowledge my name, acknowledge my pronouns, to respect who I am as a person, respect who I say I am, has done wonders. my depression has basically leaped out the window. It's no longer, I can't say it no longer exists, but it's not as bad as it was a few years ago. I definitely don't have as much anxiety. That might also be because I am perceived as a man in the world, and that comes with its own set of privileges. And I just feel more comfortable as myself in engaging with people in conversation romantically or just making new friends. Even if that does mean I will eventually out myself. If I out myself and someone decides they don't want to be my friend, you weren't my friend to begin with. And that's fine.
Right.
But now I have the confidence to say, excuse my language, fuck you.
Right.
And that's it. Whereas before, I'd be super incredibly distraught
Right.
over at one point in my life, when I was 15, imagine that when I transitioned, I'd have to go self means you are not openly out. People don't know you're trans. You would never reveal yourself even to your romantic partners. I imagine that I would leave New York City, leave my family, go self, and never see my family again. And was super, super depressed over the fact that the people that I grew up to love, my brother, I would never, ever be able to hug him and show him who I really was. And now I can say with confidence, hey, bro, like, this is me. You want to go play ball? You know, we have a better relationship because he sees a truer side of me and he respects that side of me as well. So I love him more for his respect towards me.
Absolutely. Thank you for sharing that. It's really, really beautiful and very powerful. I think so much of what has been sort of emphasized through various different conversations we've had today about, the question of, from Teresa's presentation earlier, life purpose being this sort of something that when folks are able to claim that, and she was speaking about Native youth and being able to claim life purpose and how that's an incredible sort of preventative measure for mental health issues, to be able to have your self and your personhood and say, this is who I am, take it or leave it, right? And to say I don't actually owe myself, my personhood, to anyone else's definition, anyone else's category, it's incredibly powerful. And I think folks really do fear that when it comes to trans lives, trans experience, right? We see this desire from the politician side in particular to regulate that and say, again, how dare you choose who you are? How dare you say no to other people's perceptions of who you are or who you're supposed to be? When actually it's a real site of personal and incredible power, right? And I think to be able to say, as Audre Lorde would say, right, like what feels right to me, and to claim that power for yourself, and especially from a position, from a body that's racialized, that's gendered in a way that has historically been oppressed or marginalized. It's incredibly powerful, and it moves people sometimes to the point of feeling uncomfortable with themselves. And they say, oh, well, you have to be this way or choose these things and you can't access this or that, right? But it's actually incredibly powerful to say, no, I love myself at every stage in every way. I will transition constantly, right? I will take on different versions of myself, whether that's different pronouns I might use at different aspects and moments of my life, or different clothes I might choose to wear. But I want to move through the world freely as me. Right. And that's the one constant truth. Like, that's incredibly powerful. And I really appreciate you sharing that, not only in your story, but doing the work that you do to uplift so many queer and trans voices. The new show, Brave Spaces, is exploring that, how queer and trans folks affirm one another in these almost hyper-local ways, bowling leagues that are queer and trans, and sort of maker spaces, creative spaces where folks are gathering together and saying, we are here, we're a beautiful tapestry of human experience, and so much is possible from that place. So I think with that, I'd love to move to my last question, and I invite more questions. We've got some coming through, but questions to come in, which we'll get to after my last question, which is about, what does healing look like for us in this moment?
Oh, I still don't know how to answer this question. Healing is a range of things. I think for me right now, combination of therapy and community. And therapy is really important to me because as someone that grew up in a Black family who was taught that therapy is only for white people, not for BIPOC people. that we don't do these things. We don't go to therapy. We're just really strong. We're headstrong. We can do it on our own. And to realize later on why I was such an anxious person all the time, because I am shouldering all of my issues instead of talking it out with anyone. I did not start, and also here are some other misconceptions, actually, this is gonna double back, about transitioning and about children transitioning or adults. The hoops that I had to jump through just to get a letter to transition, and like a year of therapy, a year and a half of seeing a primary doctor, a year of seeing I forget which doctor this is. Regardless, I had to go through so many hoops before I could actually have top surgery, okay? And that is even without my insurance covering the top surgery. And the fact that is that so many of these policies still exist today. You cannot transition as a child unless you are 18 years old, and then you're an adult. And you still need to go get 3 or 4 letters before you can do anything, all right? But I never had therapy until I needed or wanted to transition. And I was very reluctant to it that entire year. I realize now that finding your therapist is also like finding your friend. My therapist was great. However, my therapist was not my friend. And I think that's why I was so reluctant, because I didn't feel almost entirely comfortable talking to this person about things outside of my transition. Now, I see a therapist who I found online. The website is called manhattanalternative.com, and it helps you filter through an enormous amount of things. Like, I looked for a trans therapist who was Black, who perhaps had experience with non-monogamous people. I'm non-monogamous, who understood what it meant to identify as a queer person sexually and politically, and thankfully found that person, and also had a sliding scale. I have been seeing this therapist now for 5 years, and I'm sure he doesn't consider himself my best friend, but I consider him my best friend. He's the only person that I tell everything to. And I have seen such a drastic difference in my mental health since I have started with this person. And I really detest that amongst Black people and amongst the Black community, not so much now, thankfully, but as I was growing up, we discourage others from going to therapy. The other issue, however, with therapy is, and I think I have that here, the access to it. A lot of people don't have access. So this note right here is actually about trans people who have wanted access to therapy or healthcare, mental health care, and could not receive it. Now, I'm sure the number is higher for BIPOC people.
Right.
This is just a general number. I lucked out with this website because I was able to find a therapist who accepted sliding scale. And I think that's something that should be available across the nation. The other half of that is I have friends who have insurance, and through their insurance, they're able to get a therapist, but then the people that they have seen have said, you should not be transitioning.
Yeah.
So you either pay out of pocket for someone who is affirming, or you go through your carrier and you feel as if you're being isolated again. Not just at home, not just at school, but now your own therapist. But this is the only person that you can afford to see, and you desperately need this kind of mental health help. And this person is telling you that you are mentally ill.
Right.
So why do we have health insurance for therapy? We need to improve those systems as well. The other thing, I mentioned community care. A lot of grassroots organizations in New York, they either provide funds for therapy or they create their own collective spaces. So for instance, I love acupuncture, and there is a collective in New York City that will have like sliding scale acupuncture, or free, maybe once or twice a month, where we can all gather in the same room, relax, and get acupuncture. And then when we are finished, we have a conversation, we connect, and that's community care. That's healing.
Yeah.
All of it. So it's a combination of things, but very specifically access to therapy, which is so drastically impossible in any state. If it's difficult to get therapy in the ways that we want, or at least that I want in New York City, and New York City is like a melting ground of everything, what does it look like in Iowa? Idaho, North Dakota, South Dakota? I couldn't imagine. And I'm afraid for the folks that are there that don't have access to these things.
Right. Absolutely. And it is really complicated with the question of insurance and therapists, for various reasons, sort of not taking insurance at all or taking some and having to kind of, I mean, I know with therapists have to navigate the insurance and diagnosis question, right? If you continue going to therapy under insurance, your therapist has to usually put you under some kind of diagnosis. And it might be depression, it might be gender dysphoria or something along those lines, right? And so it's a complicated dance for both providers and for folks who are seeking care. Yeah. And what ends up happening is folks fall through the cracks and are not able to receive mental health care.
Way too often.
Yeah.
Way too often. I can attest for myself. I did, my therapist did attempt to contact my carrier and did diagnose me as having anxiety. And my insurance immediately said, well, we have other options, so why would we cover your sessions? And even after the fact, after explaining, well, I'm this person, I'm Black, I'm trans, I'm also helping my client with their non-monogamous relationships. Mm-hmm. The insurance carrier did not care.
Right.
At all. Oops, I think I have one more. Q&A.
Oh, no. Well, thank you so much for answering my questions to start. I think we have a lot of stuff coming in through the chat, so I will read through some of these questions. We have a lot of sort of affirmation and folks really excited about your presence and being able to just affirm the work that you do. Let's see. We've got a few questions in here about what it means to be an ally to the trans community.
Oh, wow.
What would you say to that question? What sort of message would you offer folks who are really moved by what you've shared today, but also really don't know where to start, what to do?
You know, I was actually working on this presentation yesterday on how to be an ally, and of course I forgot everything that I wrote. However, I might have some notes here. Well, first I would like to say that being an ally is a verb. When we say LGBTQIA, some people mistake the A for ally, and I like to say that A is not part of the LGBT community because you are a friend. You're not on the alphabet mafia spectrum, if I may. But you are a verb. You are actively speaking up for us in settings where we can or cannot speak up, whether we are present or not. So if you see any person being transphobic or engaging in homophobic behavior, you stand up, you speak up. Another example of this is maybe perhaps microaggressions, where, say, if you and I were in a meeting and someone in the audience referred to you as she or he, another person in the audience to say, actually, the pronouns are they, them. Right. It's small things like this, but also major things like going out to protests. Did we not all just experience the BLM protests? I hope many of you were protesting along. I was. I'm obviously Black, but I like to say I'm an ally to my own community as well. And I would hope that the rest of the BLM movement is an ally to Black queer folks like myself. I am forgetting something at the moment. However, I would also say it is always just being a voice at times when your queer or LGBTQIA friends cannot speak. When they have too much anxiety, when you see that there are policies being initiated that are anti-queer, again, going to vote, calling your senators, that is allyship. It is doing something, not standing by.
Absolutely. Thank you for that. And I'm so glad you mentioned the pronoun piece. One thing I always say about pronouns to folks is most of the time they're being used when you're not actually in the room. So that's kind of the huge place where allyship can really matter, yes. Right? If you're talking about someone, say you're talking about our talk with community members after this, right? Mm-hmm. Are you going to refer to us by the pronouns we've given you on the slides and that are written on our bios if you look us up, right? Or are you going to say whatever you feel most comfortable with? And what where does that choice sort of sit for you, right? I think those are forms of allyship, because you might be talking to someone who's never heard someone with sie, them, theirs pronouns before,
Right.
or they, them pronouns before, and they might say, well, wait, what pronouns are, what was, and you can explain, well, that's the pronouns the person used. This is what they talked about with their experience. This is what Z talked about with their experience, right? And fumble and say, you know what, I'm still working on it and practicing it. It makes a difference, right? And those kinds of small linguistic shifts can really change broader community conversations.
Right. Another part of allyship is I actually suggest to people that if you are fumbling with pronouns, if you are in a workspace, what you can do is assign neopronouns. I hate to call them neopronouns. Neopronouns to one of your coworkers, and then during that day, you'll refer to that person with neopronouns, and that's how you can get your practice in.
Absolutely. I love that suggestion. Practice.
Practice makes perfect.
Right.
And also, if you make a mistake, like you said, it's okay. Just don't emphasize the apology. Don't prolong it, because you're going to eventually embarrass the person that you're apologizing to. Say sorry and just continue the conversation.
Absolutely. And I also liken it to when people mispronounce your name, which I think is something that happens to a lot of us in a lot of different ways, right? It doesn't feel great to be misrepresented or misrecognized in that way. And just, apologize, ask for the correct pronunciation or the correct pronouns, and move forward, right?
Yes.
That can make a huge difference. We've got a lot of questions about trans movements and politics. So what, and there's so many different directions those questions can take and have taken in here. But what would you say is, a really great question here is what do you see is happening on sort of an international or cross-national scale with trans movements? And do you see that there's trans movements happening in that way?
What comes to mind actually is J.K. Rowling in UK. and I think that we could do better by uniting between the two countries, specifically because although things are really terrible here, I think we are a little bit more advanced. At least we have an idea that trans people should exist, whereas I noticed there is a lot of inter-community fighting amongst what we would call TERFs, and trans people in the UK. And I think that the other letters of the spectrum are more aligned with trans people here than the UK, or some Asian countries are a little bit further behind, as opposed to India or Thailand, which I think all have trans inclusive policies. I was in Cuba recently, and they have laws where you will be sent away for a significant portion of your life if you attack a trans person on the street, which clearly is very different than US right now. I think that we could do better by aligning with our allies abroad, and I don't think we're there yet. I believe that social media does help to make those connections. I'm not sure where the disconnect is, though, and I cannot answer that question fully without fully understanding what that disconnect is. And I think it's just that we are so overwhelmed by, and shocked, I think, by what's happening here. Because if you think about it, the Marriage Equality Act was passed, 2014? And I think many of us believe that, not that this was the end, but that we were moving in the right direction. And then this backlash just came so suddenly that it caught us off guard. So I think that we are so overwhelmed with fighting back against that we can't really get a grip on what's happening across the world, even though we should. I believe it will eventually happen. We might need a few years first.
Right. I mean, there's so many resources needed too when it comes to sort of movement building, right? I think that folks are exhausted from doing the work of fighting here at home.
Right.
So that's a huge thing. I think there's also, and I say this with my cultural anthropologist hat on, about, there's so many different terms and conceptions of gender that vary culturally and cross-nationally. So sometimes the language of trans really obscures gender diversity in other places, right? People might not necessarily identify as trans, but they'll use a wide array of other gender categories that have existed for a long, long time, like Hijra and in the Indian context, which is some folks who identify as Hijra also have access to the language of trans and identify as both. Some folks don't. And it has a particular kind of cultural meaning in that context, right? So there's a lot of different, and there's versions of that across the world, and there's versions of that exist in sort of pre-colonial contexts as well. So there's so much at play with building a sort of transnational or cross-national trans movement that I think can cause, yes, that disconnect, but also I think contribute to sort of the richness of a conversation about gender. And even as we think about what it means to be a person with a gender in our world, right? So there's a lot there, I think, to think and talk about.
Yes.
And to learn about, which, we all can try to anyway.
At least also from a non-Westernized context as well.
Right, absolutely, not so U.S.-centric if we can. There's a great question here about envisioning non-carceral strategies to interrupt anti-trans and anti-queer violence.
Ooh. Wait, can you repeat that?
The question is how would you envision non-carceral strategies to interrupt anti-trans and anti-queer violence?
Oh, can I get back to you? I want to think this one out. That's an excellent question. However, that would take me a little bit of time. That's something I would like to write out.
Right. I mean, it's a huge question. I think it's one that, these organizations that you're tapped into in New York and across the country and the world that are trying to sort of navigate that, right? How do we respond to hatred with love? How do we respond to anti-trans rhetoric, violence, language with something that's not just, let's lock up communities, right? That's what non-carceral kind of responses mean. So I guess
I would still have to think longer on that, but a shorter answer is, it's really difficult to put yourself out in community without possibly being targeted directly, being doxxed. But back to stats, I actually wish I had this here. There are stats that show 67% of people that knew a trans person that were surveyed were more likely to support that trans person and to affirm that person, whereas 60-ish% of people who did not know trans people would discriminate. And I think really it's all about getting, I hate to say visibility, double-edged sword. But sometimes the positive aspects of visibility are really important. To have a trans person in media, to say, when I'm not a fan of Caitlyn Jenner, however, when Caitlyn Jenner came out as trans, there are people in Idaho, in Iowa, that can say, I know a trans person.
Right.
I think Caitlyn Jenner is a terrible example, but obviously because she supports a lot of anti-trans legislation, which makes no sense to me because, I think if it were possible for grassroots organizations to exist in other states, in the ways that exist in New York, and have these people meet non-trans people so that those folks could learn we're just existing and we're just trying to live our lives without impacting anyone else, that could really turn things around. I'm not sure how we would get there, especially since there are now laws and policies that say you cannot have these organizations in so-and-so states. And that's why I want to think about the longer answer.
Yeah, and I don't think it's a quick answer question. It's a big one. And I appreciate your thinking on it, especially on the fly with a question like that.
Right, I'm like,
it's a big question and a great one.
You've got to sit down for that.
Yeah, I mean, that's multiple
that's
minds
an article.
in a room together. Yeah, it's an article. It's an organization, a series of organizations working together to build something out where we can think about what that looks like in this moment. So I appreciate you thinking about that here. I guess for the final question, someone asked if you see hope moving forward. And I guess I'll sort of ground that question with sort of what is giving you hope in this moment?
This conversation is giving me hope. To talk to another trans and non-binary person gives me hope. To see that so many of us are existing and living our lives and thriving, to be alive. I am now 32 years old, and I didn't think, again, I didn't think I'd see my family after I transitioned, but I also didn't think I'd survive after a certain age. And here I am. You know, that gives me hope in and of itself, to see that trans kids can openly be queer, or at least are trying to openly be queer and trans. That gives me hope. Their determination gives me hope. The determination of their parents really gives me hope. And I want to emphasize that a lot, because again, I had a parent that did not support me. And on a personal level, oh my goodness, what is Dwayne Wade's daughter's name?
Zaya.
Yes, Zaya. Geez, how did I forget that? On a personal level, I was extremely jealous of Zaya for a long time, because I could not understand how your parents could support you when you were queer or trans. And it took a lot of therapy to come around. And once I realized that what they were showing her was love, of course, love that I didn't get, I really had hope in the fact that such a public family was openly loving on their trans child. And there are so many other families that are willing to leave the states that they're in to support their trans child. That gives me hope that these people exist and that they're encouraging their children to be themselves. What else gives me hope? I would say the fact that these conversations are even being had anywhere gives me hope. Because we could still be existing in silence, and we're not. We're being talked about, sadly in a negative way, but I think that can be eventually turned around. That gives me hope. I would say what also gives me hope is finally finding love, whether it has been through multiple relationships or not. I also imagine that I would never have a love of my life. I've had many at this point. I'm single now. Not that that matters. I'm non-monogamous anyway. Just, you know, things that people dream, that non-trans people think and dream of every day, that I never thought could be for me. That gives me hope. The fact that there are trans people acting, trans people hosting news TV shows, that's even outside of my own show. The fact that there are trans people with #1 single records like Kim Petras and Sam Smith, that all gives me hope.
Yeah. That visibility, it's a double-edged sword. We see people really angry about that, but it is meaningful. And young people and grown folks, we see that, and it makes us feel like, you know, we can be free, and we can sort of choose ourselves, and that's huge. I want to thank you so much, Devin-Norelle, for this conversation. Thank you all for your engagement, for your questions. Thank you so much for your brilliance, your advocacy, and your presence here today.
Thank you so much. And thank you for having me here.
Thank you, Devin-Norelle, and thank you, V. Very engaging conversation. And may I say, this was so inspiring, Devin-Norelle. Your honesty and sharing your lived experience was just so moving. And I think that's the hope, right? Having these discussions and normalizing it. How do things become normal? We just keep talking about it. And thank you for educating me on so many of the steps that are necessary, and educating so many people about the misinformation that's out there. Thank you truly for a wonderful discussion.